So Beyond an Apple a Day is a course that's offered through the NNLM. And I wanted to let you guys know that there are longer options. There are Moodle courses that are several weeks long, but I'm going to give you guys a little bit of Beyond an Apple a Day light in our short period of time. I was introduced by you guys, but I want to remind you that I am your NNLM liaison for South Carolina as well as for Northern Florida. So if you have education questions or I'm your liaison, I would love to hear from you. And any of you guys are welcome to reach out anyway. There's our little map again. Lauren lovingly covered all of that. So what is consumer health information? You guys have probably heard definitions left and right, but the one I prefer for our discussion today is by the Icahn School of Medicine. Consumer health information is information on health, medical conditions, and medical topics available to the general public at any layperson level. So our learning objectives, even though they're going to be, each thing is going to be short because our time, 30 minutes isn't long. We're going to review and compare some consumer health resources, utilize health literacy and public health content knowledge to use NLM resources so that you can meet your community's needs and be able to interpret demographics and recommend solutions. So why is this important? More than ever right now, we heard earlier today, maybe even a couple times, about mis and disinformation. How many times have you been scrolling or heard a family member scrolling and they saw things like this? The taco cleanse that changed your life. What else? Wearable stickers that promote healing. Really? Fluoride, poison on tap. Drinking red wine could help burn fat, but don't worry, because National Vodka Day said drinking vodka is healthier than a glass of wine. There are so many competing sources. And so health literacy is a way to navigate through all of that for your patrons. Questions you might hear that indicate you're dealing with consumer health. My mom is starting to forget things. How do I know if it's Alzheimer's? I know you guys have heard some of these. Why did my doctor put me on Prozac? I want to find more about that diet thing Dr. Oz talked about. I just found out my son may have Marfan syndrome. Do you have a book about it? My 23andMe test said I could get breast cancer. What do I do now? So here's a little quiz for you guys. What do you think is the strongest predictor of an individual's health status? Do you think it's age, income, employment status, education, literacy skills, or racial ethnic group? Literacy skills. So that is something that we as librarians can take on and do take on. And many of you are probably already doing health and wellness initiatives and consumer health in your locations. So here's another quiz. See if you can guess. 1 out of how many American adults reads at the 5th grade level or below? 1 out of 5. That's a pretty high number. And the average American reads at the 8th to 9th grade level. So most healthcare materials, though, are written above what level? Above the 10th grade level. So we're doing a disservice to our communities. Plain language is really important. So we talked about what consumer health information is, but we want to also work on health literacy. So we want the people that we serve to have health literacy. And that's the degree to which they have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And this has become increasingly important throughout the last few years as we deal with pandemic and long COVID and just so many different things that we haven't had to face before. So why is health literacy important? There are tons more reasons than I could put on this sheet, but it affects everything about the way you relate with the world, how you access your healthcare services, how you look at the risks and benefits of treatment or any part of your health and wellness. It seems simple, but calculating dosages. When you see on a bottle, take 2 times per day, are you taking 2 pills 2 times per day? Or are those 2 pills the 2 times per day? Even saying it out loud as someone who is pretty health literate, that can be difficult. How you communicate with your healthcare providers. Do you feel confident? Do you have the right questions to ask? How you evaluate information for credibility and quality. Are you thinking about the taco cleanse? If that was a thing, I would be thinking about the taco cleanse. How do you interpret test results? An example of that for me is my doctor's office is so fast to put those test results in the portal. And there've been a couple times where I was in a big hurry and even I was tempted to play Dr. Google and see what those test results are. So I want to take away that temptation and give us quick, easy resources to share and for ourselves. So we're not Dr. Googling those test results since they come in before the actual analyzation by the doctor. So also being able to locate health information. Are you playing Dr. Google, or do you have other resources that you can link to? So to have good health literacy requires a pretty wide range of skills. So basic literacy seems like all it would be, but you also have to have numeracy, biology, computer literacy. Think about how hard it would be to navigate your health and wellness, especially the last couple of years, if you didn't have computer literacy. That's a real issue. We are so fortunate to be able to be on this call virtually, but so many people cannot access telehealth. Media literacy, cultural and linguistic competency, and digital literacy. So particularly vulnerable populations are folks over 65, racial and ethnic minorities, recent immigrants, people with less than a high school degree or a GED, people with an income at or below the poverty level, and people whose first language is not English. So someone with COPD may say things that indicate that they may not have the best health literacy. My breathing problems are controlling my life. No matter what I do or how hard I try, I just can't seem to get relief from my breathing problems. And you may not be talking to someone with COPD, but these sound like other things I've heard. And I always, I worked in public libraries for a really long time. So I think about my patrons across the desk, but I also think about family members. When you're the librarian, you're the person people come to with this information. So another thing they might say is, too often my breathing problems just seem to hit me from out of the blue. And these sound like just normal things. But when you think of it in the context of low health literacy and COPD patients, they may not realize how to utilize their prescribed inhaled medications. They may not be able to recognize the need for acute medical attention. They may feel just helpless and overwhelmed by their disease. They are 5 times more likely to go to the emergency room and 8 times more likely to be hospitalized. So libraries are partners in healthy communities. And when you do take some of the course that I'm talking about now, the one that you're in, except much longer, you guys are in the mini session, a lot of it is geared toward public libraries, but libraries in general can be partners in a healthy community. So we have free resources. We can give people evidence-based, up-to-date health information. We are safe. Like, someone may not have access to a place where they can safely and privately look up health information. We can also help them so that they have assistance going through the process. And then it can make such a big, impactful difference to do health-related programming and outreach. I've worked in communities where there weren't as many like free health and wellness programs, and what we did may have been most of what happened in that small community. So the programming and outreach that we do is really significant. And we model healthy behavior with workplace wellness. An example of that is when I worked at one of my small public library branches, we were doing just staff, like a health and wellness program where we were trying to participate in the county, and everybody's motivated by gift cards. So we're trying to win some gift cards. And we were just so close to our community. They came in every single day that they would join in with us and encouraged us. And so we started doing health and wellness programs for them because they get so excited with us. That connection between having a place to be excited about health and wellness is kind of beautiful too. Something unique that libraries can offer. And then evaluating health information is a big piece, of course. You guys know from general reference, but the same types of things work for health reference. So you have the ABCs of evaluation, your A's, accuracy and authority. How accurate is the information? Is this based on sound medical research, or is this just an ad that's clickbait? Who is the authority? Who published the page? Is it a medical company advertising their medicine? Bias. Is the author using data improperly to promote a position or product? Is this like a celebrity trying to sell their product? Currency. This is so important. Again, hating to use the pandemic, but we've seen how quickly health information changes and morphs in response to what's happening. Always we're learning and changing. So if that page was updated 4 years ago, you're multiple iterations behind. So knowing that you're using a good currency is great. Coverage. Are there sources given for additional information? This is again where those little ads all over the page, someone may be really wanting to delve deeper. The little summary they have isn't enough. So they start clicking and trusting whatever pops up. So sending people to a place that doesn't have those pop-up ads allows them to dig around and build more comfort and knowledge about what they're dealing with. And then usability. Is it user-friendly and easy to navigate? some pages that have great information, if they are not set up for accessibility, or if they are just generally difficult to use, their usability takes them away from the ABCs of evaluation. And then an easy way to sell this to someone who is pretty new is trust it or trash it. So to think critically about it, easy 1, 2, 3. Who said it? When did they say it? And how did they know? So this would be a great tool too, if you're working with teens, to start building that. They may have more knowledge than we do, but teens are people who are just getting used to thinking about health literacy. Trust it or trash it. And then as we're dealing with, especially a lot of people still like going back and forth between like working from home and doing their health from home, a lot more people have turned to health applications. So some of the same terminology would work, like you could do trust it or trash it, but there's also suspect. So seeking, does this app even meet your need? People want you to use their apps, even if they're free. They get, of course, money for the times that people download. So making sure that the app actually meets your need and is not just trying to get clicks. Usability, same thing, but especially with computers, is it something that's easy to click through, or are you having to constantly make moves with your fingers that are uncomfortable? There can be a lot of accessibility issues within that as well. Security, when you're creating your account, how much information do you have to have? How long is the privacy policy? You have to read the privacy policy. Raise your hand if you've read a privacy policy recently on an app. They're horrible. They're like 30 pages, but it's really important when you're dealing with your health and wellness in particular. I'm going to say always, no judgment though. So what is the upfront cost of the app? Even if it's free, a lot of people who are newer to technology don't understand the in-app purchases. They don't even understand when they're setting up their account information, what the outcome will be. It's terrible. So like price is a really big factor. We want people to have access to free, equitable information. Evaluation, always read the reviews. It's so tempting in our evaluation world to be like, this has 5 stars, but read the ratings, find out good information. And this is something great to teach folks. The creator who made this app, are they trustworthy? Do they have a website? And then timeliness. Again, when was this app made? Was it created 6 years ago and not updated? Yikes, I hope not. And then resources that you guys could utilize. So there's Dr. Google. The example given is autism. Of course, a lot of us know how to truncate, use quotation marks or parentheses to make better results. But someone could go into Google and just type autism. And I had to update the number because we're up to 357 million results. How many of you guys think that you could easily and successfully navigate 357,000 results? I know I could not. So Medline Plus gives us a little bit more of a reasonable result, 956. It's still a lot, but you know that within that 956, they're trusted. And we'll get more into why these are trusted resources, but I can do a lot better with under 1,000 than I can anything over 1 million. And then the first result that you see right to the left of 956 is if you click on that link, it's the autism health page to the right. And you'll notice when you're in Medline Plus, this similar format where you can get basics, learn more, summary. And this similar format is really helpful for learning. People know what to expect. The predictability of the page is very helpful when you're learning and comparing medical issues. So why is Medline Plus great? Well, it's reliable and authoritative health sites. Everything is easy to read. It's written in that consumer level reading range. And if you're looking within the links, the easier information is at the top and you can click for more detailed information. So you can get as easy, simple information as you need, and you can go deeper. There are also other resources that go much deeper that are free from the NNLM as well. You can get lab test information. The social media is great. Some of it is located in other languages, like this website is Spanish language. And then most importantly, I think, is the no advertisements, because I do think a lot of people get caught up in that. So multilingual and multicultural, NIH and Medline Plus are offered in Spanish language. If you notice to the right, the Medline Plus page looks very similar. They try very hard to make consistent look of the page regardless of the language. So this is in orange, but you can see the similar layout, the similar features. Same thing with the NIH page if you were to compare it to the English language page. And then Medline Plus is offered in multiple languages. So if you look to the far left under health information, of course, circled multiple languages, you can see what is listed below. For our example, we used Armenian, and you can see that as much as they could, they tried to keep the format the same of this page as well. So it's great that those are offered. And then drug information. I'm giving you guys like a quick run through. So hopefully, if someone in your community needed this information, at the very least, you have this, you will have access to these slides, and you'll have information and resources that you can utilize. And then for Medline Plus, it has a drugs and supplements page. One of the neat things about Medline Plus is if you're under a condition and you look under medicine, it'll link you to drugs, herbs, and supplements or clinicaltrials.gov. So different places link so that you can go from one trusted site to another. And that's a really important feature. And then we have the National Center for Complementary and Integrative Health. This site is really special because it does have that information about herbs at a glance, but it also has like, what do you do? Like, how do you find a practitioner? How do you inform yourself about this? What is the science behind this? It has a combination of the science that we all need, evidence-based medicine, but also the practical concerns of finding out what your best option is when you feel trapped, right? They also have, speaking of like trusted, if you look at the circle around App Store and Google Play, there is an app, the Herbalist app from the National Center for Complementary and Integrative Health. And that is, I think, pretty cool because if you were in the store and you were looking for something and you wanted to do a quick check, it's one step closer to trusted than maybe just a sales rep giving you information. Our resources are great for special health topics. So we'll start with diet and exercise. Medline Plus has a little box that's health and wellness to the bottom left. And you can find some great information there. I love the healthy recipe of the week. You can also get that through the social media. There's really interesting facts that come through social media too, especially if you do Medline Plus Twitter. It's good stuff. And then you can also link to health topics under disorders and conditions. If you see circled in the middle in red is the word cancers. And then to the right, you can narrow it down to specific cancers. And you can see, again, this page has that same look at the bottom right. In red is the medical encyclopedia. And then that we also have the National Cancer Institute, which is another trusted source. It is really great because it has a lot of information about finding clinical trials on that front page. And so you can also click on different cancer types. And so I've highlighted skin cancer on the right, but this is a common question that I've seen. And then I really appreciate that Medline Plus treats mental and behavioral health in the same way that they treat any other medical concern. So if you look in the middle of the page under disorders and conditions, you can see mental health and behavior. And if you click on that, you can pick anxiety, which I selected to the right. And same thing, you've got your medical encyclopedia with links. I've highlighted it on this page. And you can find the same quality information. If you scroll down, it'll say more information and you can get much more links. So great resource. And then mentalhealth.gov and SAMHSA are both excellent. Mentalhealth.gov, you see our veteran on the front. There is a lot of really important help for veterans, like that veteran crisis line. Both sites are great about providing National Suicide Lifeline on the front page. But I appreciate that SAMHSA has that disaster and distress helpline. Both of these pages, as well as a lot of these other resources, are great to keep in your digital ready reference so that you can quickly refer people. You never know what you'll need, but these could save lives. And then the National Institute of Mental Health is really great. They have, if you look at the health topics to the left, it's the blue box right here. You can see more topics below it, and it'll give you a different list that's more inclusive. But their featured topics are always really great. And even if you just came once in a while to look at featured topics, it would be worth it. And then publications. I know that a lot of times for folks who don't want to talk about sensitive issues, having those publications out can be absolutely life-saving. So having links to those is helpful. If you look, it says order now. You can also call the phone number, and there are publications in both English and Spanish. And there are books, brochures, fact types, posters, a lot of different publications. And those might be a way to get the information out to someone who is more reticent to have the conversation. And there's also population-specific resources. You can go into Medline Plus under health topics. And as highlighted in the yellow-orange color, you can see that you can look for information by specific population demographic groups. And then womenshealth.gov has great information on, especially I love the top and trending health topics. But there also are really great categories that you can refer folks to, like guides to breastfeeding, caregiver stress. Excellent resource. I'm trying to zoom through for you guys now. Children and teens, Kids Health has some great information, and you can look across the top that we also have information for parents, educators, and then of course for kids and teens themselves. So we used to get a lot of questions about things related to children's growth, and this is an excellent resource for that. And then girlshealth.gov covers a huge amount of like trusted information, from bullying to STDs or STIs and sex, relationships. And I used to get a lot of people who wanted those like growing up books for girls. And this is a great complementary source to recommend as well. Prenatal to young adult covers exactly what it says. And you can click on the age in this middle row, prenatal, baby, toddler, and you can get information specific to that age group. Really great, especially for planning for adults. And of course, older adult health, the National Institute on Aging has really great information. The Alzheimer's Disease Research Summit is coming up. Oh, that's really outdated. How about that? I borrowed this slide, so don't look at that. But anyway, the National Institute on Aging has some great information, and you can browse A to Z in the similar way. And then the National Resource Center on LGBTQ Aging is a really great center. A lot of it is aimed toward mental health resources, but still it gives great support resources for the LGBTQIA plus community. And then I've given you some resources where you can look at the demographics of your community to be able to offer better health and wellness resources. And then just a few like tips. You want to make sure that during the health reference interview, you give the same and more than you do in a traditional reference interview. So we're going to be welcoming, an active listener, understanding that people are going to have feelings and emotions, watching body language, understanding that when people are getting medical information, they may write it down incorrectly, or they may be hearing it on the phone and writing it down. So being really patient and helping people find the right information. And then just like always, like repeating the question to make sure that you're getting what you wanted. And we talked about patients may be fearful. They may have a lot of feelings that we have to deal with. Factors that may affect information seeking behavior from the data: age, gender, literacy level, socioeconomic background, culture, ethnicity, language, and I would add gender and sexuality. Okay. And then reference skills are the same as any other reference skills. Confidentiality is super important. And then we don't interpret medical information, even if it's tempting. We don't offer personal experiences. Know your limits and limits of collection access. Don't be afraid to refer folks back to their healthcare provider, and use a disclaimer. I won't make you guys sit while I read through this, but it'll be in the PowerPoint. Have a disclaimer in that area so that it's really clear that you can give help, but that we are always going to refer folks back to their healthcare provider. And then understanding that these questions can be very complicated, looking for the right level of information and what format would be most appropriate.
I think we're going over time.
Oh no, then we'll skip it. Get your chiss. I know we started late.
That.
It's okay. So do we have time for one or two questions, or not so much?
Well, we did have a late start, and you actually answered the two questions that we had. Dot asked, would the PowerPoint be accessible, and you did answer that question. And then Kate asked about how to word the disclaimer when providing the interview, and you also shared examples of that in the PowerPoint. So we want to thank everybody for attending this session, and for the sake of time, I'm going to turn it over to the next session. Thank you.
Thank you, guys.